Good morning, everyone, and thank you for joining us. I'm Altaf Stationwala, President of Unity Health Toronto. It's my pleasure to welcome you to St. Joseph's Health Centre, a site of Unity Health Toronto, for this morning's announcement. Before we get started, I want to begin with a land acknowledgement and some special welcomes. Unity Health Toronto acknowledges that the land on which we live, work, and operate on, Toronto, is part of the Dish with One Spoon Covenant territory, and is the traditional and ancestral lands of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, the Chippewa, and the Wendat nations. It is a land that is part of Treaty 13 signed with the Mississaugas of the Credit in 1787, also known as the Toronto Purchase, which was revisited in 1805 and in 2010. It is still home to many First Nations, Inuit, and Métis peoples. By acknowledging the land, we acknowledge the treaty responsibilities in sharing this land and to the Indigenous people who have been the traditional caretakers of this land since time immemorial. I want to start off by extending a special welcome to our government partners, the Honourable Sylvia Jones, Deputy Premier and Minister of Health, the Honourable Peter Bethlenfalvy, Minister of Finance, and the Honourable Raymond Cho, Minister of Seniors and Accessibility. It's a pleasure to have you here with us this morning. Unity Health Toronto is proud to work alongside the Ministry of Health and partners across Ontario to provide compassionate, high-quality care to patients at every stage of their healthcare journey. For many patients, having the right home care supports in place is essential to feeling safe and confident when they leave the hospital. Patients who receive these supports tend to have a smoother discharge experience and a steadier recovery at home. We are grateful for the home care services available to the residents of Ontario, which help ensure patients are well supported once they return home. Many of our teams collaborate closely with home care providers to support patients in the community. Today's announcement will strengthen these services and continue improving the discharge experience for all Ontarians. We look forward to continuing to work with our ministry partners to keep Ontarians safe, healthy, and independent. I would now like to welcome Minister Sylvia Jones to the podium.
Thank you, Altaf, and good morning, everyone. It's great to be back at St. Joe's Health Centre alongside Minister Bethlenfalvy and Minister Cho, who have both been incredible partners to building a more connected and convenient healthcare system in their communities and indeed across Ontario. On behalf of Premier Ford and our entire government, I want to extend my sincere thank you to Altaf Stationwala and the entire team at St. Joseph's for hosting us again today, and for your unwavering commitment to delivering exceptional care to people and families across Ontario. Under the leadership of Premier Ford, our government has been making record investments to protect Ontario's healthcare system and transform frontline healthcare in every corner of our province. We are taking bold and innovative action to make it faster and easier for people and their families to connect to the care they need when and where they need it at every stage of their life. Through our government's historic investments, we are connecting everyone in Ontario to publicly funded primary care by 2029, creating record growth, our healthcare workforce, investing nearly $60 billion to get shovels in the ground on more than 50 hospital projects, and expanding access to more convenient care right at home. Thanks to Minister Bethlenfalvy's steadfast work through the Fall Economic Statement, our government's investments will help shape the future of home care in Ontario, allowing even more people to receive convenient, high-quality care in the comfort of their own homes, surrounded by their loved ones. By expanding home care services across Ontario, we are supporting patient independence and recovery, while easing pressures on hospitals and freeing up beds for those who need them most. Since 2022, our government has invested a historic $4.6 billion to improve access to home care, and the results have been noticeable. Through our investments, more than 650,000 patients are now receiving care at home each year. And we have reduced the wait list for personal support services by 94% in just 3 years. And innovative initiatives like Hospital to Home are helping more patients safely and seamlessly transition from the hospital to their home sooner, reducing readmissions and improving quality of life. We are truly getting it done for patients and their families. Thank you again to St. Joseph's Health Centre and all our healthcare and community partners who work tirelessly to support high-quality home care and help people and their families in Ontario heal, live, and thrive independently in their homes. It's now my pleasure to invite Minister Bethlenfalvy to share more about today's exciting announcement. Thank you. Stay well.
Well, thank you, Minister Jones. Thank you, Station Walla, and all the team here at St. Joseph's. Thank you for your tireless work. Bonjour tout le monde. I want to say, you know, when I talk to people, who doesn't want to age at home? Just about everyone that I know wants to get out of the hospital and wants to get home. And those that can be taken care of at home is a big win for patients. And so I want to thank you again for the great work you do here at the hospital and all the staff and people that make this possible and make today possible. I particularly want to thank and welcome Minister Sylvia Jones, who's been a tireless champion for healthcare in the province of Ontario, and Minister Raymond Cho, my best friend forever, my BFF, you know, who's also been tireless helping seniors and accessibility and all the issues that go along with aging in this province. Thank you for being such a great champion as well and being a partner in our government's work to protect Ontario. As a part of our plan to protect Ontario, our government is continuing to focus on careful fiscal management that allows us to make smart investments, investments that strengthen our economy and vital public services that people depend on every day. Ontario's home and community care is a foundational part of our healthcare system. Each year, Ontario's home and community care system supports 650,000 people, helping them live independently and receive the care they need where they're most comfortable, as I said before, at home. That's why today our government is investing more than $1.1 billion over the next 3 years to strengthen our home care services. And as part of that investment, we are investing $982 million over 3 years to maintain and strengthen critical home care services, supporting patients with more complex needs, while also stabilizing and expanding Ontario's home care workforce. Nurses, personal support workers, and other professionals who deliver care in every corner of the province. This investment also includes more than $170 million to enhance and expand the Hospital to Home program, funding that will help to develop at least 18 new sites and expand the 23 existing sites to help more patients transition safely from hospital to home. These investments are about more than healthcare. They're about ensuring that Ontario remains resilient and self-reliant. By expanding care closer to home, we're improving efficiency across the system, supporting local jobs and service providers, while helping communities grow stronger and more sustainable. Il veille à ce que l'Ontario demeure fort, résilient et autosuffisant. En offrant des soins plus près du domicile, nous améliorons l'efficacité dans l'ensemble du système et nous soutenons les emplois et les fournisseurs de services locaux tout en aidant les collectivités à devenir plus fortes et plus viables. These are strategic investments that strengthen care and stimulate economies, meaning more jobs, new contracts for local service organizations, and greater stability for communities that rely on these essential services. This is what it means to protect Ontario, building a stronger, more resilient province that focuses on smart investments, supports its people, and keeps its economy going forward. Through our plan to protect Ontario, we are taking a balanced, fiscally responsible approach, one that protects what matters most today while building the foundation for long-term prosperity tomorrow. As we invest in care closer to home, helping patients recover safely, supporting families and easing pressures. Our hospitals, we are also investing in Ontario's future. Investing in the people, the communities, and the industries that keep this province growing. Dans le cadre de notre plan pour protéger l'Ontario, nous adoptons une approche équilibrée et financièrement responsable. Une approche qui protège ce qui compte le plus aujourd'hui, tout en jetant les bases d'une prospérité à long terme pour demain. Tandis que nous investissons dans des soins de proximité, que nous aidons les patients à se rétablir en toute sécurité, que nous soutenons les familles et les réduisons les pressions sur les hôpitaux, nous investissons également dans l'avenir de l'Ontario. Nous investissons dans la population, les collectivités et les industries qui assurent la croissance de cette province. Now, I know Ontario's best days are ahead. Because of our fiscally responsible management, we've been able to increase spending in our healthcare system by over 50% since 2018 to the healthcare sector. 50%, from $60 billion to over $90 billion. And together, we will make this province the greatest destination to invest, grow, and succeed anywhere in the G7. I look forward to updating everyone as part of the 2025 Fall Economic Statement on November 6th. So thank you, and now it's my pleasure to welcome and introduce the Minister of Seniors and Accessibility, the great Mr. Raymond Cho.
Thank you, Minister of Bethlenfalvy. Good morning. I'm Raymond Cho, Ontario's Minister for Seniors and Accessibility. It's an honor to join each of you today, including Deputy Premier Sylvia Jones and Minister of Finance Peter Bethlenfalvy. Under the leadership of Premier Ford, they are two of my favorite ministers. Why do I say that? Because they are working so hard for seniors all across Ontario. And any minister who's working hard for a senior is my favorite minister. Our seniors deserve to live with dignity and respect. Our seniors have given and continue to give their time, energy, wisdom to build our province. Today's announcement is another important way that our government is empowering seniors to live in our communities as long as they wish. The expansion of home care helps provide our seniors our independence. It empowers them with choice. It remembers that they are first and foremost people who deserve respect. I want to thank Minister Jones and Minister Bethlenfalvy for their steadfast leadership. This is one more reason why Ontario is the best province and the best country in the world, Canada. Thank you.
We will now take reporter questions. Please identify yourself by name and outlet. And as a reminder, it's one question and one follow-up.
Hi there. I have a couple questions for Minister Bethlenfalvy. It's Lorenda Redekop with CBC News. Ads fall under your ministry. With that government ad that has led to headlines around the world, did you keep the federal government in the loop before going ahead with that ad?
Oh, sure. There's lots of conversations between the Prime Minister and Premier Ford. They have a great relationship. As you heard last Thursday, the Premier reiterate that Premier Ford has 100% confidence in Prime Minister Carney. We're in this together. The ads were factually accurate, and of course we're best friends and allies and neighbors, and so the best thing that we can get, we need to get a deal, but we need to get a good deal, and the collaboration between the Prime Minister and the Premier will continue.
Okay, so before the ads went out, the feds were fully in the loop what that ad was about.
Well, I'd have to, that's my understanding, but you'll have to ask Premier Ford or Prime Minister Carney that question.
Thank you. And a follow-up, you're the money man, Skills Development Fund. The opposition parties have been asking questions about that. It was every day last week in question period. I'm guessing that will continue today. Lots of question marks about that $2.5 billion fund. It seems the opposition, they're okay with the money, but they want there not to be this conflict of interest or appearance of a conflict. So are you uncomfortable with this fund? Are there guardrails or changes that you would like to see in how that money goes out?
I'm completely comfortable with this fund. It has helped literally hundreds of thousands of people, 700,000 on our way to retraining, reskilling 1 million people for the jobs that we need them to do in this economy. We need to power our economy. 100,000 jobs were filled because of this program. So I think it's a great program. We need it now more than ever, given the economic challenges we face. So it has the full support of our government.
Hey, Minister Barbara with QP Briefing. I just want to ask actually about the announcement today. It seems that what you announced for home care was already announced back in 2022. So what exactly is new about this announcement?
I'll let the Deputy Premier and the Minister of Health expand on the question. But look, we've been investing in home care. What you're referring to is the first phase of our investment in home care. We're transforming our healthcare system to move people in the right place for the right care at the right time. I'm a big believer and champion for home care. As I said in my remarks, I haven't met anyone who doesn't want to age at home. And if we can provide more of the supports at home, be they personal support workers, medical, the facilities, etc., those are critical to people aging at home. And that includes our hospitals where my father, who was in this hospital not too long ago, he preferred to be at home rather than sitting in a bed here. And the hospital would have loved to get him out. So the more supports that we can provide to let people age and get medical care in the place that is best suited for them, I'm a big supporter of, have been since day one. I'll let the Deputy Premier answer the other part of the question.
Yes, as Minister Bethlenfalvy referenced, this is an additional expansion. We have seen really high success with, for example, a program called Hospital to Home. And not only does it ensure that that patient gets seamless assistance as they move from hospital to their home environment, community environment, we've also seen data that shows they are not coming back through the emergency department because the hospital staff, the clinicians, the experts are still involved with that patient. So if there is any change in their treatment and their pathway, they can actually deal with it in the home at the home care level, as opposed to having that patient re-enter through the emergency department. I'm really excited about the expansions because I've seen how much of a difference they make in the communities that are using them.
Thank you. Another question for Minister Bethlenfalvy. Minister, the last time I asked you about waiving the HST and whether you were considering this, you told me that you would run a forecast on how much in tax revenue would be lost each year from falling housing starts versus, how much in savings waiving the HST would actually generate. So have you done that, and is this something you're still considering?
Well, you know what, we've mentioned that if the federal government follows through on providing HST relief for first-time home buyers of new builds, we'll follow suit. And we continue to call on the federal government to cut taxes, to provide relief for individuals and businesses. In the budget that I tabled in May, there's some $13 billion of tax relief and fee relief for individuals and another $12 billion, almost $12 billion for businesses. So we're calling on the federal government to follow our lead, where possible, cut taxes for individuals and businesses, put money in their pockets. That will help drive the economy, and so we haven't wavered from that. And of course, we'll continue to call on the federal government to support the nation-building projects and as well focus on getting a good trade deal for Canada.
This will be the last reporter question.
Good morning. Jamie with City TV. I'm going back to the commercial that gained so much attention over the weekend. How much did it cost to produce? How much was it budgeted for? And how much is, since it's been paused, how much have we spent and how much is still yet to be spent?
Well, I don't have those numbers at my fingertips, and of course, all of that comes out in the public accounts once we finalize all the numbers. But I will say this, that we indicated $75 million. Obviously, we paused the campaign, advertising campaign as of today, but we'll do an accounting of the exact numbers.
I don't want to burn up a follow-up, but one of my questions on a follow-up, but was it money well spent?
I think it was money extremely well spent. It achieved its objective of increasing the narrative and the awareness that a trade war hurts both countries, that it's in the interest of both countries to get a deal, to get a good deal that's sustainable, that supports workers. We're always going to support workers and our businesses here in Ontario. We're stronger together, and I think the ads achieved that objective.
Thank you, Minister. And I have one question to the Minister of Health. I got to frame up my camera. Hang on.
It's because I'm shorter than Peter, isn't it?
Thank you. Parkdale Safe Injection Site Community Center is about to close. There's a lot of outcry. They've seen an increase in usage as a result of other safe injection sites being closed. What do you have to tell those people that no longer have a safe injection site to go to? And I understand their hearts opening up in the neighborhood, but that's not the same thing.
Well, you're absolutely right. It's not the same thing. We want to offer people pathways to treatment, pathways out of addictions. And so the money that was being spent at a consumption site, essentially ensuring that people continue to use deadly drugs, is actually being transferred to a heart hub that's going to give people hope and a pathway out. You know, the heart hub model, as we've seen them open in various communities across Ontario, we're literally seeing people served that are getting health care for the first time ever, that are getting supportive housing for the first time ever, that are getting access to treatment for their addictions and their mental health issues. It is a all-encompassing pathway that ensures people can get help where they are at and what they need immediately. And the money that was being spent at the Parkdale consumption site is now going to be moved to a heart hub. Very happy that we've actually gone to a treatment model, not just illicit drug use. Thank you.
That now concludes this press conference. Thank you, everyone, for coming.